The carbon remedies. Now we are talking about in general carbon. Why are we talking about carbon? Why? Because let's come back. And now today I'm going to talk to you about in the next 1 hour about carbons. What is the main patterns of the remedies belonging to carbons? This one. So let's come. So carbon, we have more than 200 remedies in carbon group. Yeah, more than 200. And you know that it is one of the most basic element even in human beings, and it is one of the important part of Earth's crust. You know this already. And there are so many different allotropes of carbon in chemistry. You know this already. And there are some very, very common remedies. You know this again in carbon. We have carbo vegetabilis, carbo animalis, graphitis, petroleum, carbolic acid. These are well known carbon remedies. And of course, you know many more. Huh? You know that calcarea carb is carbon, baryta carb is carbon, lithium carb is carbon, magnesium carb is carbon, strontium carb is carbon. So you can imagine. And there are some lesser known carbons also, like carbonium sulf, like carbonium oxygenator. Today we gave one patient, me and Dr. Utsa, we prescribed a very nice remedy to one man who had lung fibrosis, and he constantly vomits black color sputum. We gave a remedy called as Pix liquida. Very interesting. We gave today to one patient. He gets pain in the left chest and vomits and coughs black color sputum. This is very important for Pix liquida. I'll write here black expectoration. He had a lung fibrosis. Okay, this is a remedy that I use sometimes. So there are many known and unknown remedies in carbons. What is generally the use of carbon for so many things? For jewelries, for roads, for shoe, for technological things, for tires, for pencil leads. And carbon compounds are everywhere, you know. Carbon dioxide, benzene, methane, ethanol, DNA, natural gas, isn't it? Which has a composition of carbon, hydrogen, nitrogen, petroleum, coal. We are talking about something which is everything in and around you. If you look around you, you'll find a lot of things which has carbon in it. But what I'm going to talk to you about carbon, what I want to talk to you about, there are certain very important patterns in carbon remedies, which I'm going to tell you about. What are the important patterns which I want to tell you? Carbon remedies. Now, this is a little different state. This is a transition. And as we keep going from the left to the right side, you will start seeing the remedies on the left, that is lithium, beryllium, boron. They are low in confidence, they are more clingy, they are more dependent. And the more we start going on the right side, you will see that the ego is starting to develop a little more, the self worth is starting to develop a little more, and the need for independence is starting to develop a little more. And interestingly, carbon, and we will discuss this, is somewhere in the center. If you see this very clearly, the periodic table, the carbon is in the center of the periodic table actually. On left side is lithium, beryllium, boron. On right side is nitrogen, oxygen, fluorine. Now let's try to understand how is the personality of remedies belonging to carbon group. Are you all with me? Are you getting a little idea what we are trying to say till now? Say yes. So I told you, first of all, the remedies which all the remedies which are here, right? All the remedies which are in row one and row two, right? This row two here in lithium, beryllium, boron, carbon, right? These are all very needy people. They are people who are very clingy, who are childlike, very dependent. But as we go from borax, which is very dependent, totally dependent, very clinging, you know, and there is a rubric in borax that clinging to the furniture. Can you imagine? You know how you get clinging like that. In carbon, the first thought comes to your mind that should I be dependent or should I be independent? Should I start doing something? Should I start being independent? Can I think for myself? Can I develop my own identity? This is the first time it starts happening in carbon. Till boron, they can't even think. You're so clingy for everything. Carbon start thinking, could I be independent? Can I do something on my own? Can I develop my own identity? So the idea in carbon is more and more about how do I disconnect and be on my own? The main pattern that they have is issue of self-worth and self-recognition. It's a state of transition where a state of child is more like a borax who's very dependent. No, don't go, don't go, don't go. In carbon, the idea is okay, you can go now. I think I can manage on my own. So this is what, this is a very important. And you could see that in our patient also, today's patient. She feels very insecure. She feels very, very unprotected. So she's in a state of confusion actually. Should I let him go or should I be with him? Because she needs his kind of, warmth, care, security. But she's also not happy. So she's somewhere in the middle. She feels suffocated on one side. On another side, she wants to get out. So it's a very interesting state of confusion. What you will see in patients who require carbon remedies that the structure is more developed than boron. They are they are developing their primary identity. They start symbolically trying to develop their own identity. They often use the word sustain and stability. But there is also a lot of weakness, total inadequacy in sustaining themselves. And it's a very interesting phase because till till the lithium, beryllium, boron, the person, even a 40-year-old man or a woman, like yesterday's case, like Dr. Jaya shared, she was a 40-year-old woman, but she would get into a panic as soon as her partner would go out. Don't go, don't go, don't. This is the state. Can you imagine? So from borax, when you go to carbon, the next phase, the phase is where you're not exactly like borax, you're not exactly like a child, and you're not totally an adult. So they are neither child, neither adult. So they are somewhere in between. Imagine somewhere between teenage, somewhere the child age could be 10, 11, something like that. So a person could be a 40-year-old, but the inner age could be more of a 10-year-old. So it is known as an in-between age is carbon. And that's why these people would love to do a lot of childlike things. So there's a lot of transition phase and many patients come in this carbon state. The feeling is I want to be on my own, but I'm not able to be. I want to separate, but I don't think I'm capable enough to separate. So they have thoughts about doing their own job, doing their own thing, developing their own ego, but they feel they don't have the confidence to do it till now. So it's the first time this thought comes in. Should I? So ailments from puberty is a very important symptom in graphitis, almost important like ailments from menopause. So the main conflict in carbon remedies is I don't have the strength, the stamina, the confidence to develop my own identity, to develop my own ego, to develop my own self-worth. This is the conflict. And because of that, the feeling is if I go on my own, I will collapse. So there is a lot of fear of failure because there is a total, still one half of them is still dependent on nutrition, on a parent like figure. So it's a very in between phase. The idea is that the age is often like frozen. It's almost like I told you, it's a 45-year-old man or a 60-year-old woman whose inner age is still 10, 11. They are not able to take up important and very simple responsibilities like the carbon remedies like graphitis, petroleum. They cannot leave their parents, not because they want to take care of the parents, because they still don't feel confident enough to have their own house and live on their own. This is something that you will see.